Hey everyone, I hope you're doing well and are having a flare-free day. In today's video, I wanted to touch upon chronic pelvic pain and what that could entail. I know with endometriosis more specifically, I deal with chronic pelvic pain non-stop. I've been dealing with it for more than 12 years, and I'm sure if you're watching this video, you are experiencing pelvic pain that just doesn't seem to go away. In this video, I wanted to touch upon what chronic pelvic pain is, what the symptoms are, and what could potentially be causing that type of pain. If that interests you, then keep on watching. So chronic pelvic pain is actually more common than we may think. Approximately 1 in 7 deal with this type of centralized pain. Thinking about 1 in 7 individuals dealing with it on an ongoing basis breaks my heart. And I also feel like it's really sad that we don't know more about chronic pelvic pain with that amount of individuals experiencing that localized pain. So the diagnosis of chronic pelvic pain, also known as CPP, is made between 3 to 6 months, meaning that a doctor wants to see if this pain is ongoing and not based on a injury or a traumatic experience where that part of the body is healing. Basically, if you're feeling pain or discomfort on an ongoing basis past the 6-month mark, even the 3-month mark, it should be time to book an appointment with your doctor just to get things checked out. Don't necessarily have to feel sharp, excruciating pain all the time. That pain can come and go, which we like to call flare-ups. So if you're feeling pain that comes and goes for 6 months, that's also a reason to talk to your doctor about chronic pelvic pain. It's found between the belly button and the hip bone. So any type of pain that you feel in your lower stomach or lower abdominal muscles can be defined as chronic pelvic pain. Now, CPP has so many presentations and one size does not fit all when it comes to what you feel symptom-wise. So some of the symptoms that might be associated with chronic pelvic pain include increased menstrual cycle pain, constant severe pelvic pain, intermittent pain, so that pain that comes and goes throughout the month, a sharp or cramping pain, sort of like a dull aching or like a pulsing sensation in that lower abdomen, pressure. So sometimes you might feel heaviness, especially on your bowels or your rectum or your bladder within that lower belly. That pressure can be associated with CPP. Depending on your chronic pelvic pain, it might be described as a dull ache, a sharp shooting pain. For myself, it's often a twisting sensation, a sensation of barbed wire around my lower pelvic region, tugging. Sometimes it feels really hot, so like a lighter of heat is going across my lower belly. You may also experience extreme amounts of pain in that pelvic region based on your menstrual cycle, pregnancy, physical activities, intercourse, or even having a bowel movement or urinating. It also can get worse during menstrual cycles. So that chronic pelvic pain for me, caused by endometriosis, which is that underlying cause of my pain in that pelvic region, does cause extreme amounts of pelvic pain during my menstrual cycle. Your CPP might intensify if you are sitting for long periods of time. So if you're at your desk or at school and you're noticing, wow, like my lower belly really hurts right now and I've been sitting for a 2-hour lecture, it might be related to CPP. The catch-22 with this is that CPP can also cause extreme pain if you are standing for long periods of time. So try and find a balance of sitting and standing if that's something that you experience the pain with. I find for myself lying down or having a little bit of a rest in between days so that I'm kind of horizontal helps decrease the amount of pain I feel from time to time. It doesn't necessarily alleviate the entire pain threshold that I'm having, but it does kind of help provide relief in certain circumstances. If you're feeling any of these symptoms or it's an ongoing problem, it is so important to go check it out by a medical practitioner or doctor. They can do some tests and run some things to see if there's an underlying cause to that chronic pelvic pain, especially if this pain disrupts your day-to-day life. That's something that needs to be investigated. Now, chronic pelvic pain comes with so many nuances and so many potential underlying causes. It could be caused by an inflammatory disease, another chronic condition like endometriosis. It can also be a characterization in itself known as chronic pelvic pain syndrome. So there are so many things that could be relating to that pelvic pain, meaning that it's so important to go talk to your doctor about the pain you're experiencing. Some possible causes of chronic pelvic pain include, but are not limited to, so this list is not extensive, but definitely an important list to refer back to, includes gastrointestinal issues, so celiac disease, colon cancer, inflammatory bowel disease, irritable bowel syndrome, as well as colitis. Gynecological issues can also be the cause of chronic pelvic pain, such as adenomyosis, endometriosis, polycystic ovarian syndrome, cysts, fibroids, dysmenorrhea, which is also known as period pain, pelvic inflammatory disease, or other gynecological concerns or issues. Musculoskeletal concerns can also be the cause of chronic pelvic pain. This can include degenerative disc disease, fibromyalgia, or stress fractures. Urological conditions can also cause this type of pain, which includes bladder malignancy, chronic urinary tract infections or UTIs, interstitial cysts, or radiation cystitis. There are so many other different causes of chronic pelvic pain, and the list can go on, but these are just some of the reasons that could be related to chronic pelvic pain. Now, obviously there are so many underlying causes that could be causing CPP, so diagnosing it and the underlying cause may come with a lot of tests and procedures, so something to keep note of, but definitely keep a journal of your symptoms and experiences that you're having month to month. That can kind of help narrow down for your doctor what a potential cause of that CPP could be. Some of the examinations that could take place, depending on the pain that you're experiencing and where you're feeling it in that pelvic region, could include a musculoskeletal examination. They might look at your posture or your lumbar support. Pelvic examinations are also extremely common, so based on your history and if you feel that pain during menstrual cycles. For myself, I always have the physical examinations, and that might include an internal and external pelvic examination. During that type of examination, your doctor or clinician will check if there's tenderness or soreness, lesions or growths that are happening within the pelvic region. They might also look for signs of infection or inflammation during that type of examination. Now, if you feel pain during this type of examination, it is so important to use your voice and to state that you're just not feeling comfortable or you're experiencing pain. Now, I know for myself with endometriosis, pelvic examinations can be painful during and following the procedure. So I always kind of outline to myself, okay, like I'm mentally preparing myself for this examination. And I also let my technician or ultrasound tech know that I do experience pain. Diagnostic procedures or tests might be run, so cultures, imaging tests such as ultrasound, x-rays, or MRIs. Another way to investigate is through a laparoscopic surgery. This is very common with endometriosis. Oftentimes there will be small incisions made by the surgeon, and they'll insert a small camera to look around the pelvic region. Look around your pelvic organs, around your tissues, and just see if there's any inflammation, infection, or growths that are happening and causing that underlying CPP. Now, treatment of CPP, again, is super complex depending on your underlying cause. So definitely reach out to your doctor to see the best course of action that relates to the underlying cause of your CPP. Physical therapy management can be an excellent option to address CPP. Pelvic floor rehabilitation has been wonderful and a great support for endometriosis for myself, so I highly recommend pelvic floor rehabilitation or therapy. Physiotherapy and Kegel exercises can also help, but always talk to your doctor or practitioner to ensure that the things that you're going forward with to help with pain management are appropriate for treating the underlying cause of your pain. So I hope this video has helped. If you have CPP, please feel free to comment down below what you do to help alleviate that pain. Any support or advice that you have for those that are just diagnosed with CPP could be really helpful. I know it would be helpful for me to read motivational statements and support because, again, we're all in it together. If you're just diagnosed with CPP, know that you are not alone. You are not alone. I'm with you. I am here with you. If at least you know that one person out there is experiencing CPP as well, I hope that helps in some measure of what you're going through. I can only imagine the pain and discomfort that you experience, and I think you're so strong, and I think you're brave for advocating for your health and your body and your pain management that works for your unique body. With that, I will talk to you on the next one.